Welcome to today's explainer. You know that feeling, right? You wake up, your throat is absolutely on fire, you've got a sudden fever, or maybe an earache that just won't quit. And immediately, that anxiety kicks in. You start wondering, is this serious, or is it just going to pass? Well, today, we are going to completely demystify the 5 most common infections treated at walk-in clinics. By the end of this, you're going to be armed with the exact knowledge of what's happening inside your body, and, most importantly, exactly when you need to grab your keys and seek medical help. To really wrap our heads around the scale of this, just look at this number. According to the CDC, acute respiratory infections alone account for tens of millions of outpatient visits each year in the US. Tens of millions. And honestly, when you add in urinary tract infections, skin infections, and ear infections, the numbers are just staggering. Look, being sick is stressful. There's absolutely no way around it. It messes with our routines, our sleep, and our peace of mind. But it definitely helps to know you aren't alone in this. Infections are literally the undisputed capital of urgent care visits. The really good news here is that most of these are super straightforward to diagnose and treat if you know what to look for and seek care promptly. Okay, let's dive into our roadmap for today. We'll briefly hit the urgent care capital, then explore ear and throat infections, check out the skin and urinary tracts, break down respiratory infections, and finally, pinpoint exactly when to seek medical care. Let's get right into it. Section 1. The urgent care capital. Moving right along to Section 2, ear and throat infections. Let's start our tour of the body right at the top, the head. We're going to focus first on the absolute misery of ear infections. These can be incredibly disruptive, especially if you have a family. So let's look at the classic symptoms. These infections can affect the outer ear, which you might know as swimmer's ear, the middle ear, or the inner ear. What's totally crucial to note here is the behavioral signs, especially in young kids who can't exactly tell you what hurts. Middle ear infections are so common in little ones. If you've got a fussy, feverish toddler who is frantically pulling or tugging at their ear, that is a massive red flag. For adults and older kids, you might notice the pain actually gets worse when you lie down to go to sleep, and that's often alongside muffled hearing or, in some cases, even fluid drainage. So how does a provider actually know for sure what's going on in there? Well, they use this handy little instrument called an otoscope to look straight into the ear canal and right at the eardrum. They're specifically looking for redness, bulging, fluid buildup, or even a tiny tear or perforation in the eardrum. If it turns out to be a bacterial infection, they'll usually treat outer ear issues with antibiotic drops, while middle ear infections generally need oral antibiotics. And to manage that intense pain while you're healing up, over-the-counter ibuprofen or acetaminophen are pretty much the standard go-to recommendations. Okay, moving down to the throat, there is a very common point of confusion we really need to clear up. Most sore throats, they're actually just viral. Sure, they're super frustrating, but they usually clear up entirely on their own in about 5 to 7 days. But bacterial strep throat, which is caused by group A streptococcus bacteria, is a totally different story. It absolutely requires antibiotics to cure. It turns out this specific bacteria causes roughly 20 to 30% of sore throats in kids and about 5 to 15% in adults. So, how in the world do you spot the bacterial kind? Well, strep hits hard and it hits fast. You're looking for a really sudden onset of severe throat pain, especially when you swallow, accompanied by a fever of 101 degrees Fahrenheit or higher. If you actually look in the mirror, you might see swollen tonsils with these distinct white patches, and you can usually feel swollen lymph nodes right in your neck. Interestingly enough, a huge hallmark of strep is what you don't have, meaning an absence of a cough or a runny nose. If these symptoms are lining up, a rapid clinic test takes literally 5 to 10 minutes to confirm the bacteria. If it's positive, you'll generally be prescribed antibiotics like penicillin or amoxicillin. Section 3. Skin and urinary tracts. Now we're moving down to the body's surface. Skin infections can range from mild all the way to quite serious, and they can be bacterial, viral, or even fungal. The most common ones include cellulitis, which is a spreading bacterial infection of the skin and underlying tissue, abscesses, which are basically pockets of pus, impetigo, a highly contagious bacterial infection we see a lot in kids, ringworm, which is fungal, and of course your standard infected insect bites or cuts. Diagnosis here is highly visual. Providers do a visual exam looking for the classic signs: redness, warmth, swelling, tenderness, and any drainage. Depending on what the culprit is, treatment ranges from oral or topical antibiotics to antifungal meds, or even minor procedures like a quick incision and drainage for abscesses. Next up, we have urinary tract infections, or UTIs, which are incredibly common, particularly for women. And these symptoms are super recognizable. You've got a burning sensation when you go to the bathroom, a really frequent urge to go, but with only a tiny amount of output, cloudy or strong-smelling urine, and often pelvic pain. If you're experiencing these, a super simple urinalysis at a clinic can confirm a UTI in literally minutes. The relief is incredibly fast, too. Most patients feel significant improvement within just 24 to 48 hours of starting their prescribed antibiotics. All right, Section 4, Respiratory Infections Explained. There's a really key division in how medical professionals view your respiratory system. On one side, we have upper respiratory infections. Think of your common cold, sinusitis, and pharyngitis. These are mostly viral, bringing along that oh-so-familiar congestion, runny nose, cough, sore throat, and usually just a low-grade fever. But on the flip side, we have lower respiratory infections, which affect the lower airways and lungs. This category includes bronchitis, which brings a persistent mucus-heavy cough, and pneumonia. Pneumonia totally elevates the danger level here, adding high fever, chills, shortness of breath, and chest pain into the mix. Because pneumonia is sitting deeper down in the lungs, it often requires a chest X-ray at the clinic to fully confirm it and to guide the right antibiotic treatment. And finally, Section 5, when to seek medical care. So you know the symptoms now, but when do you actually need to step foot inside a clinic? Let's walk carefully through these criteria, because honestly, these are fantastic rules of thumb to just keep in your household. If you're an otherwise healthy adult with mild cold symptoms, the best action is usually to just wait it out with plenty of rest, fluids, and over-the-counter meds. But you absolutely must seek care if your symptoms are dragging on for more than 7 to 10 days with zero improvement. Temperature is a hard and fast rule too. Seek care for an adult fever over 103 degrees Fahrenheit, or if you have an infant under 3 months with a fever over 100.4 degrees. You also need to head in if your symptoms start worsening after they initially seemed to get better, or if you ever experience any difficulty breathing or swallowing. Keep these timelines and temperatures memorized for sure. The whole reason we tell you not to ignore those red flags is the escalating danger of untreated infections. They rarely just stay put. A simple UTI can progress upwards and turn into a severe kidney infection, bringing high fever and awful flank pain. A skin infection like cellulitis can dive deeper and actually enter your bloodstream. And that strep throat we talked about earlier, if left completely untreated, it can eventually lead to rheumatic fever. Getting a prompt medical diagnosis is exactly what breaks this chain of escalation. Which brings up a question I see literally all the time, and I want to pose it directly to you right now. Can I get antibiotics for an infection without actually seeing a doctor? I mean, if you just know you have a sinus infection, can't you just get the medication? The answer is a hard, definitive no. Antibiotics strictly require a prescription from a licensed healthcare provider. And the reason for this is absolutely critical for all of us. Not all infections are bacterial. As we've learned today, so many common ailments are actually viral. Using antibiotics for a viral infection does absolutely nothing to cure you. And what's worse, it actively contributes to the massive global crisis of antibiotic resistance. A provider has to properly diagnose you first to ensure the medication will actually work and to protect public health as a whole. So I'm going to leave you with this final thought. The next time you feel a fever spiking or a sudden severe sore throat appearing out of nowhere, will you know exactly when to just wait it out and when it's time to walk into a clinic? Remember, infections rarely improve just by endlessly waiting around. The sooner you get the proper diagnosis, the faster you get back to your normal life. I really hope this explainer empowered you with the knowledge to make that call with absolute confidence. Keep learning, stay healthy, and we'll catch you on the next one.